Welcome, Senator Jensen. Committee members, before us is Senate File 3019. Senator Jensen, please move your bill and begin your presentation.
Thank you, Madam Chair. Madam Chair, I have an amendment.
Senator Jensen, this is not your first stop. If you could walk us through the amendment, which is the bill, and so members, we will have discussion after the initial amendment to the content of the amendment. Senator Jensen, please begin the walkthrough, and council summary is to the DE, as is the fiscal note. Go ahead, Senator Jensen.
Okay. Madam Chair, I would like everybody to look at the A19 delete everything amendment. We start out with dependent child notice, and we move to section 2 in regards to information provision and the insulin safety net program. We move into the insulin safety net program and the establishment of it. We lay out definitions and then move to eligibility. I would share with the committee that the eligibility requirements for the urgent component versus the ongoing component are different, and the biggest difference would be the 400% federal poverty guideline requirement for the ongoing insulin. We move on to the pharmacy duties in regards to the urgent need insulin program, and I think it's important to say that if you have a desperate Sunday afternoon diabetic patient who walks into the pharmacy and has less than 5 days of insulin in reserve and attests to the fact that they're a Minnesota resident, a diabetic with a valid insulin license, and they don't have access to insulin that totally costs $75 or less per month, they're eligible right then and there. They sign a document and they'll be given 30 days of insulin as they walk out the door. In addition, they will be given the information as to how to apply for the ongoing program. The pharmacy will be taking the product, the insulin, if you will, from their inventory, and they will be made whole by the manufacturer either through a credit process or through a shipment of product. We move to subdivision 4 on page 4, and we see the continuing safety net program, and that has some general information, but essentially it calls on the manufacturers to create public assistance, patient assistance programs that meet the requirements of eligibility, and on page 4 you'll see those eligibility requirements. Subdivision 5 goes on to elaborate on the manufacturer responsibilities, specifically in regarding the receipt of an application. They have 10 business days to address that. If there is an issue in regards to eligibility, there is a pathway for an appeal if the patient is identified as being ineligible. Subdivision 6 on page 5 elaborates on the process for the ongoing safety net program. The pharmacy will forward to the manufacturer the information in regards to where the product can be shipped if the manufacturer chooses to not ship it directly to the patient. So the pharmacy manufacturer would ship the product, and the product would be shipped either to the pharmacy or to the patient, him or herself. It goes on to talk about the fact that the pharmacy may charge a co-payment not to exceed $25 for each 90-day supply. Subdivision 7 talks about the Board of Pharmacy responsibilities in terms of posting information sheets on websites and trying to provide adequate information for all diabetics so they might know what's available to them. The Board of Pharmacy has a clear responsibility describing the urgent need insulin safety net program, and then also to be able to describe each manufacturer's patient assistance program. In addition, it will provide information on how to contact a trained navigator for assistance in applying for medical assistance, MinCare, qualified health plans, or patient assistance programs for manufacturers. I think it is appropriate to mention that many situations that might come up will involve people that may not be aware of the fact that they are eligible for MinCare or MA, and Mr. Stefan Gildemeister has testified to us previously that perhaps as much as 50% of these folks might well be eligible. And so to simply address just the insulin product isn't enough. We need to go further and make certain that we're not about Band-Aids, but that we're looking at the comprehensive health of the patient and trying to get that patient connected with the support and the coverage that they might be eligible for. Subdivision 8 on page 7 discusses dispute resolution. Subdivision 9 calls for a penalty on manufacturers if they are non-compliant. Subdivision 10 calls out for a list of reports that the Board of Pharmacy must receive from the manufacturers annually. Subdivision 11 identifies a sunset program. Then we move into section 4, and we talk about the boards ensuring that licenses are provided with information on the insulin safety net program. Section 5 identifies a public awareness campaign. Section 6 has a severability clause, and I won't go into detail on that unless there are questions in regards to that. Section 7 identifies appropriations and has some blank spots on lines 9.3, and I will cover that with the fiscal note.
Thank you, Senator Jensen. And members, the amendment is before us, and so we'll discuss it before we'll take a vote to adopt the amendment. So discussion to the points of the amendment. Senator Wickland?
Thank you, Madam Chair. Yeah, looking at the amendment itself, I mean, I want to say first, I'm glad that we're having another hearing to talk about this issue, and then that you've brought forward a new concept that's different, quite different from the initial bill you passed or that we passed out of the committee, and I'm grateful to see that now we're discussing funding in such a way that the manufacturers are bearing the responsibility for providing the insulin. I think that we had discussion in the last hearing on that topic, and I am grateful to see that that has been changed to manufacturer responsibility. Also, I guess, I wanted to just say that I'm happy to see that the eligibility for the emergency insulin, I think that's a great idea to not have a poverty or a federal poverty guideline or eligibility criteria on that, because I know we've discussed in the summer, we talked about how people might be in different situations, their income might be above 400%, but they might really be in a situation of needing the emergency insulin. So I'm glad to see that part of this amendment as well. I think the concern areas that at a high level, the concern areas I have with it are relating to kind of the amount of a copay that somebody would be expected to come up with if they need the urgent need supply. I think having a $75 copay, I think, could be a real barrier to someone who's in that situation. So I would like to keep talking about that as we discuss the bill. I think the initial version that you had, there was an opportunity for someone to get an additional 30-day supply so that if they kind of ran out of time trying to work through some of this eligibility for other programs, that they would have an opportunity to get another 30-day supply. And so I hope maybe we can talk about whether there's a way that we could do that, because I can see people getting in a situation where they are applying for insurance or applying for Minnesota Care or public program, and they just haven't, everything isn't set up yet. So I'd like to see us have a way to talk about that further. Then I guess, one of the things that shifting this to a manufacturer and pharmacist, kind of an operational program for them, I have concerns about how do we make sure it all happens, that the manufacturers actually get things set up, and how do we make sure that patients are able to access the urgent need and the continuing need items as stated. I know there is a clause in here about a penalty. I guess the penalty right now, I think you have $100,000 per year amount, and that seems to me to be not sufficient. You know, I really think that if a manufacturer, if they knew that that was the only penalty for, if they didn't comply, that wouldn't be sufficient to kind of incent them to make sure everything is set up properly. So I'd really like to see us discuss increasing that. I think last time we talked about the sunset. I have even more concerns about having a sunset if the program is mainly a manufacturer responsibility, because we really don't have, I don't think we have a comparable program set up that we could count on this all to happen. And then why wouldn't it be needed after 3 years? I guess I don't see a compelling reason for stopping the program. So that still is a concern. I have some kind of technical items that I had an amendment drafted to, and I don't know if you want to talk about generally the amendment and see if we want to vote on that first and then go to other amendments, or how you want to do that.
Senator Wickland, Council, is Senator Wickland's amendment drafted to the A19 as adopted? So we'll adopt the amendment, and then I know Senator Jensen has a technical amendment to get some things in order, and then after his technical amendment, we could go to your amendment. Okay?
I guess I'll leave it there and let other people may have some comments about the amendment, and
Okay.
we can go from there.
Madam Chair,
Thank you. To the A19, Senator Jensen.
to Senator Wickland's point. Thank you, Madam Chair. Thank you, Senator Wickland. I really should step back. I fumbled. I should have said right out of the blocks that I really appreciate all the work that my co-authors have put forward, including Senator Pratt and Senator Benson and Senator Abler. But I would even be more remiss if I didn't comment, Senator Wickland, on the contributions you have made, which have been extremely extensive, and Representative Mike Howard as well. So thank you. These points that you're making, I don't disagree with one of them. I don't. I think you missed one. And the copay, I agree. We need to talk about that further. The 30-day, if we're in the middle of a process whereby a person's situation still is critical, we need to be able to take care of that. Thank you for bringing that to my attention. The penalty, we need to continue to talk about that. The sunset, we need to talk about that as well. The one situation that your comments prompted me to think about was the disputed situation as well, when someone is declared as ineligible. If during that period that person becomes at risk, we may need to think about how would we address that as well. So I would add that to your list if you would, please, because those are important things. So Senator Wickland, thank you.
Thank you. Members, to the A19. Any further questions or comments? So Senator Jensen renews his motion on the A19 amendment. All those in favor say aye. Aye. Opposed? Thank you, Senator Jensen. The A19 is adopted. You had a technical amendment.
Madam Chair, I would like to move the A26 amendment.
Members, the A26 was in your packets. Senator Jensen, would you explain the A26, please?
On line 1.3, after the word navigators, we insert the word provided by the Board of Pharmacy. And on line 1.4, we indicate including the number of Minnesota residents who the manufacturer determined were ineligible for their patient assistance program. And what's that gets at? We're trying to get good data. We want to know, are the manufacturers doing what they say they do? Because at the end of the day, this program has to do three things. Every unit that goes to patients has to be provided by the manufacturers at no cost to the patient or to the state of Minnesota. No person can be allowed to drop through the cracks. And lastly, we understand that the manufacturers will want accountability to make certain that they're not being taken advantage of. I get that. But the state of Minnesota, the legislature, the activists, and the patients want to know that the integrity of what the manufacturers are saying that they will do has to be assured. And so this gets at that accountability piece. If we find that there's shenanigans going on, we want to know about it, and that's why we changed some of that language. And lastly, Madam Chair, on line 1.8, we basically inserted the numbers that come from our fiscal note so that there's $76,000 from the Healthcare Access Fund to the Board of Pharmacy to go ahead and implement it. And I haven't discussed the fiscal note. I will do that when you direct me to do so.
Questions from members to the A26? Seeing none, Senator Jensen renews his motion on the A26. All those in favor say aye. Opposed? A26 is adopted. And I know there are other amendments, but Senator Wicklund, you had indicated you had an amendment. Would you like to address that now?
Sure, I can do that. It's the A31 amendment, and it's not in your packet, so if it could be distributed, please.
Might have been a drafting error. Thank you.
Oh, thank you. Madam Chair, I can,
Senator
do you want me
Wicklund?
to, I can start to talk about it.
Thank you.
When I went through the A19, I just found a few things that I think they're more or less they're technical things that I think would help clarify what the responsibilities are of some of the entities, and then just one question about funding that I just want to make sure is covered. So the first item where it says page 4, line 11, including 24 hours, 7 days a week. I just want to make sure that the manufacturers, when they're providing a contact for patients to inquire about anything, that they have it a full, fully staffed, 24 hours, 7 days a week, so that we aren't in a situation where someone gets in the middle of applying or trying to get the urgent access insulin, that they have the ability to contact the manufacturer. So that would just insert 24-hour, 7 days a week there. The second item on page 5, line 18, my concern there, the way it's written, it sounds like if someone had prescription drug coverage through a plan, that the manufacturer might be able to just have them use a coupon program. And I just want to make sure that if the person meets the eligibility criteria that are laid out in the bill in subdivision 4, that they are then qualified for the manufacturer assistance program, and they won't be asked to use a coupon program that wouldn't provide free insulin. It would provide discounted insulin. So this is just to clarify that the eligibility requirements, if they're met, that that person will qualify for the program. And on page 6, line 10, there's a line where it says that the pharmacy may charge an individual a $25 copay. And this is just to clarify that they should be charging it if there's a cost that they're trying to recoup. So to cover the pharmacy's cost is added just to make sure that there is a reason for charging the copay. Page 6, line 25, again, there's a reference to manufacturers providing information and contact information. And this would just add that it has to be available 24 hours a day, 7 days a week. And last, if I wanted to insert something that would provide some accountability for reimbursing navigators if they are assisting a patient with accessing the manufactured program. Right now, today they get reimbursed when they assist with Minnesota Care or public program access. But I just want to make sure that if they're doing this work that's different, that they are reimbursed for that. And so there's just a one-time application assistance bonus. That would be, we'd have to figure out what that cost would be, but wanted to have it included for now so that we can have more discussion about that as it moves forward.
Senator Jensen?
Thank you, Madam Chair, and thank you, Senator Wickland. Essentially, these changes, I think, are worthy of discussion, to be sure. The 24 hours, 7 days a week, I have no problem with that at all. I do struggle with the 1.4 on the amendment, the A31 amendment, line 1.4, where it says, and is determined to be ineligible. My concern there is I probably would look to the manufacturers to identify it, because my understanding is in some situations, rather than use the assistance program, which might be more, the assistance program, the manufacturer may well direct the patient to a coupon program where the cost sharing pieces are eliminated, so it's zero. I just don't know the technical details of that enough that I could speak to that issue. So I just want to say that I'm not certain that this would be in the best interest of patients. To cover the pharmacy costs, the intent there was basically to provide a dispensing fee. And then lastly, the navigators. The way this bill is constructed, we're still going to be tapping into the navigators to help patients identify their status in regards to MA qualification or eligibility, MinCare, MinSure Exchange, advanced premium tax credits, that 400% number. But in terms of actually having to have a deep in the weeds understanding of the assistance programs being provided, we're not asking the navigators to do a great deal in that regard, because quite frankly, the manufacturers will provide that. Each of the manufacturers has programs. Each of them will be called on to 24/7 availability. But each of them will, I think, be able to do a better job than we could ask navigators. Now, my experience with the navigators have been that these have been folks that have been willing and able to provide wide-ranging support beyond just eligibility for MA, MinCare, APTC, and things like that. So I'm going to guess that the navigators are already equipped to provide some aspect of support, perhaps in the same line as the United Way 211 program does, because that program also provides those kinds of things. So I would welcome the discussion as we move down the road with this. Some of these things look to me like conference committee tasks. So at this point in time, I appreciate the amendment. I would not accept it as a friendly amendment, and I'd be open for other questions.
Senator Wickland, comments?
I guess I just would like to say then, I think we need to have someone who is able to discuss what the navigators do today, I'd like to get their feedback on how this would impact them, and, how much is it similar to what they do today versus a new responsibility that we'd be asking of them.
Thank you. And Senator Jensen, I'm going to ask if there are any representatives from the manufacturers who'd like to speak to this amendment at this time. Seeing none, Senator Jensen, to the amendment. You do not consider this a friendly amendment. Do you have any closing comments for the?
I do not, Madam Chair.
Madam
Chair. Senator Abler.
Well, just in the spirit of moving, I just want to ask Senator Jensen a question, if I can. Just try to get some good things. So did you say you didn't mind the 24/7 part of this amendment?
Senator Jensen.
Thank you, Madam Chair. Thank you, Senator Abler. Thank you, Senator Wickland. Absolutely, I agree with Senator Wickland.
Okay, well, Madam Chair, would you be happy if I divided the amendment to include those elements, and then whatever happens to the rest of the amendment could be taken as a discussion later? I mean, to be voted on second?
Senator Jensen, so Senator Abler, are you moving to divide?
I guess I will just make that. So I just want to ask Senator Jensen one more question. So do you mind line 1.6?
Senator Jensen.
Madam Chair, line 1.3 in the amendment, 24 hours, 7 days a week, and then line 1.7, 24 hours, 7 days a week, are both acceptable to me. Line 1.6, to cover the pharmacy costs, is not language that I want now in the bill.
Okay.
I'd like to be a little bit more precise. I think that we need to have some conversation about perhaps representing pharmacy dispensing costs something like that. But to cover the pharmacy costs, I think that's sort of bland, and I'd rather have a little more precision in that regard. So if Senator Abler is willing to forego an exercise in long division, but instead go a short division, I would accept 1.3 and 1.7.
Madam Chair. So I'll move to divide the amendment, and staff, if they want to give advice, but I would like to move the amendment, divide it with 1.3 and 1.7 to be one of the elements, and then the balance to be the second element. I'd like to vote on the two lines first.
Senator Abler, what if you moved to amend the amendment instead of dividing the amendment? So it was just the language that Senator Jensen was willing to accept, and then we could move that language.
Well, I was trying to be friendlier toward the balance of the amendment on behalf of, Senator Wickland, who's been really working hard on this. So I think it's divisible, so I just then, and she can do what we'll take that up separately as a separate discussion. But I think that just for her interest in this thing, I think Senator Jensen is very willing to look at some of this. This has been a long time. We're close to 9-10 months on this project, and so I'm just trying to keep the goodwill as good as it can be, Madam Chair. So I will accept your guidance, but would you not rather divide the amendment, Madam Chair?
I'm going to have council walk us through dividing the amendment.
Okay.
So, Ms. Kavanaugh, to Senator Abler's motion to divide.
Madam Chair and members, I believe in dividing it, you would take, the amendment would be, the first amendment would be 1.3 and 1.7 would be the division. So
that's my
it would be
motion.
those two lines would be one amendment.
I'd like to vote on that first, please, Madam Chair.
Senator Abler, the author, gets to decide what's moved first. So Senator Jensen, would you like to move the first part of the amendment, that is lines 1.3 or 1.7, or the remainder of the amendment?
Madam Chair, I would like to move the first portion of amendment 1.3 and 1.7. I would see that as a friendly amendment.
Okay, members, questions as to the vote we are going to take? The first motion is to move lines 1.3 and 1.7. All those in favor say aye.
Aye.
Opposed? So that language is adopted. To the remainder of the amendment,
Madam Chair.
Senator Wickland.
I think, I'd like to continue to work on the remaining language, because I think 1.4 and 1.6, I think if we discussed it more, I think we could come up with some language that's acceptable. And 1.9, I think we need to have a conversation with navigators, and they're not available to talk to. So I guess I would prefer to withdraw. Can I withdraw the remainder of the amendment?
It is Senator Abler's motion, so Senator Abler can withdraw the
Madam Chair,
second.
we'll have a little parliamentary discussion. I think the author of an amendment can always withdraw an amendment, so.
But the author could withdraw the entire amendment, or to your motion.
I'm happy to let her withdraw, so I
Okay,
think
Senator
that's-
Wickland
thank you.
withdraws the balance of the A31.
And Madam Chair, I have an amendment if we're doing that.
So I just want to be clear
Oh.
with council, have we now adopted all the language we need from the A31? Okay, so members, we have disposed of the A31 favorably, adopting lines 1.3 and 1.7. Senator Wickland, we were to your amendment. Do you have any other amendments? Okay. And Senator Nelson, you actually had a comment. Was it to the A31?
No, Madam Chair, I have an amendment prospective to discuss with the author. And can I offer that now?
If you would like to
Yes,
offer your amendment.
thank you.
yes.
Thank you, Madam Chair. This is a good time to offer this amendment because it has to do with the number 7, something we were just dealing with, which was 7 days a week, 24/7. And first, I just want to say, Senator Jensen, this is a good bill. You have refined this bill, and I thank you for that. And in consultation with some professionals working in this field. I just have one comment to relay and a suggested amendment I want to ask you about. It is on,
Senator Nelson, can
It's an oral
council
amendment.
distribute the amendment?
no, it's an oral amendment.
It's an oral amendment. Okay, thank you.
Thank you, Madam Chair. Page 3 and line 2. The only concern was that limiting someone who is in urgent need of insulin has a supply less than 5 days of insulin. And I realize there's not a real way that this has to be enforced or someone has to prove that they have a 5-day supply of insulin. But the suggestion is that we move that to at least 7 days. We don't know the calendar days of when somebody is working, when they can get off work. And I would hate for someone who is in a needy situation to think, oh, I don't qualify today because I have 6 days of insulin, but you know what, I don't have any time off for the next 5 days. And so my simple suggestion would be that on line 3.2, we strike the number 5 and insert the number 7.
Senator Jensen?
Thank you, Madam Chair, and thank you, Senator Nelson. Madam Chair, there has been a lot of work gone into this, and I would feel that I would really like to have perhaps a representative farmer or a manufacturer speak to that, because I've worked through some of this language with them, and for me to unilaterally change it from 5 to 7 days doesn't feel right to me. I thought that most of the time what we're trying to deal with was patients that were distressed and without insulin and might be driven to start rationing. And I think if a person is taking 60 units a day of insulin and they've got 300 units at home, I think that the 5 days is adequate. Pushing it to 420 units, I mean, I guess we could say then 7, 10. So I would just, before I'd be comfortable saying that I'd accept that as a friendly amendment, I would like to have someone speak to that issue.
And we do have someone who is available to address the question. Welcome to the committee. State your name for the record and proceed.
Good afternoon, Madam Chair. My name is Sharon Lamberton with the Pharmaceutical Research and Manufacturers of America. This amendment, we do not have an opinion on it, so that's where we stand. No position on that. Our 3 manufacturers who make insulin might have an opinion, but for Pharma Trade Association, we are neutral on that.
Thank you. Senator Jensen, any further comments to the Nelson Amendment?
Madam Chair, could I please ask Senator Wickland to speak to this amendment?
Senator Wickland?
I think it's a good idea. I think it gives a little more of just a 1 week, supply. I would see it as a positive change to the bill.
Madam Chair, I would see this amendment as a friendly amendment and would support it.
Okay, Senator Nelson, please remind us of your motion.
Thank you, Madam Chair, and thank you, Senator Jensen. I would have discussed with you, but it was a call I just received about how important this was, so thank you. So, members, I would renew my oral amendment that on line 3.2, the numeral 5 be struck and replaced with the numeral 7.
Everyone clear? Okay, all those in favor say aye.
Aye.
Opposed? Thank you, Senator Nelson. And we have adopted your technical amendment, Senator Jensen. So
Madam
if I
Chair.
could have council walk us through.
I have an amendment.
I apologize, Senator Aber,
Sorry.
you were on my
That's
list.
the 820, if they could be passed out. I talked to Senator Jensen about this. It's, I believe it's friendly. It doesn't involve calendar or business days. But it has to talk about the duties of the pharmacy, that they would inform on their website, that they would list that they could contact the county for assistance as well. And there's a second minor change in the severability part. Instead of it unconstitutional and void, it'd be unconstitutional or void. So, and that's what you're talking about, Senator Jensen. I think it's friendly to you.
Senator Jensen, this applies to the Board of Pharmacy. Senator.
Madam Chair,
Senator Jensen.
I would see the 820 amendment as a friendly amendment.
Senator Abler, I do have a question. Do county social services have training on how to access affordable insulin, or do you think that's something that will become part of their responsibility?
Well, I didn't want to get too far in the weeds. This is a draft that we really didn't edit very thoroughly. It'd be my intention that they would be instructed to contact the county in general. Many people who find themselves needing insulin have problems the counties could help them with on a broader scale, and it's my intent to wordsmith this and take some advice from the counties. But this is, I think, a really good start. So,
Madam Chair.
and not for now, but for later. They can come to my office.
Okay. Senator Jensen.
Madam Chair, thank you, and thank you, Senator Abel. When I look at this amendment, what comes out at me in regards to county social services, and it says may contact, but generally, county social services will have a list of all pharmacies in the area. They'll have a list of all clinics in the area. If there are any diabetic support groups, they'll have that in the area. And they might well be able to have any identified 340B entities. So in that regard, I
That was
don't
funny,
think
Madam
it would be a problem.
That was funny.
Okay. Senator Abler moves the 820 amendment. All those in favor say aye.
Aye.
Opposed? Thank you, Senator Abler. Any further amendments before I go to the fiscal note? Okay, so if I could have council walk us through the fiscal note, please. I'm sorry, Mr. Albrecht. Not council, my apologies.
Madam Chair and members, the front page of the fiscal note shows you the overall fiscal effect of Senate File 3019. So in the middle there, you can see for MNsure, there's a one-time $250,000 appropriation in the bill in fiscal year 2020. And then, as you saw in Senator Jensen's amendment, the appropriation for the for the pharmacy board out of the Healthcare Access Fund is $76,000 a year. What isn't shown on here is that it ends in fiscal year 2025. Page 3 of the fiscal note is the detail for the Board of Pharmacy. Their costs are related to producing the information sheet and distributing it. Some staffing costs attributable to mostly the possibility of having to deal with appeals for eligibility, and then board costs that are also related to having to serve on those eligibility review panels. Page 8 is the health department, and in the middle of page 9 there you can see that they have minimal responsibilities and can be incorporated into their existing processes. That's under the assumptions section. Page 10 is for the Department of Human Services. They also have no costs for the fiscal note, and on page 11 you can see an explanation there. The first paragraph under the assumptions talks about that they assume the manufacturers won't require them to provide any information. The next paragraph, that MNsure would be doing the training and development of the materials, and also the Board of Pharmacy. Page 13 is the Medical Practice Board. They also have no costs attributable to it, and indicate that whatever notices they're required to give to their members, they already have existing processes to do that. Page 16 is MNsure's fiscal note. This is the one that talks about the $250,000 appropriation, how they plan to well, what they have to do is discussed on page 18 in the second paragraph under the assumptions. to develop the training materials and to make it available to the assisters, and then keep track of the navigators and assisters who complete the training, and to send that information to the Board of Pharmacy to make the list. And then if you look on at the bottom of that page, there are no totals, but the amounts are like $90,000 in fiscal year 2020, $56,000 in 21-22, and $46,000 in fiscal year 23. And then the last one is the nursing board on page 20, and they also indicate that they have no cost for that, and that their responsibilities are already part of their processes.
Senator Jensen, any comments to the fiscal note?
Madam Chair, thank you. Thank you, Mr. Albright. Just 2 comments. On page 4 of page 4, toward the bottom, perhaps the second to the last bullet allows the pharmacy to collect a copay of no more than $30. The bill actually has language that says $75. Just so I don't think it would affect it, but I wanted to make the comment that that's a presumption, I think, and I think that's incorrect. And then, since I'm about trying to keep the fiscal note down, if you add up the numbers requested from Insure, it doesn't add to 250, it adds to 248,000, but I'll leave that alone. On page 19.
Thank you, Senator Jensen. Mr. Albrecht, to the point that Senator Jensen called out on page 4, can you assure the committee there's no fiscal impact?
Madam Chair, there was no effect for the $30 copay, so changing it to $75 wouldn't matter. The reason for that is that there were a couple of changes made between the 17A, which the fiscal note was prepared for, and the 19A that you're considering now. And that was one of those changes.
Thank you.
And I got the same number that Senator Jensen got when I added up the totals as well. You can certainly address that in, is it in here or right here? On line 8.30 by changing that number to 248.
Senator Jensen, would you like to amend out the $2,000?
Madam Chair, I would like the number to reflect $248,000.
Okay, Senator Jensen, will you make the motion? Perhaps Mr. Albrecht can guide you.
Madam Chair, I would ask council to go ahead and articulate the change that's necessary in order for the numbers to reflect the fiscal note.
Ms. Kavanaugh.
Madam Chair and members, on page 8, line 30 of the A19, delete 250,000 and insert 248,000.
Any questions, members? All those in, Senator Jensen?
No comments,
All
ma'am.
those in favor say aye. Opposed? Thank you, Senator Jensen. Members, to the fiscal note, any comments or questions? Senator Wickland?
Thank you, Madam Chair. Just one comment about, I haven't read all of the details on the assumptions for each section, but I wanted to make note that on page 18, under the assumptions for MNsure, one of their statements, I think, is pertinent to what we discussed earlier, that MNsure assumes that without additional compensation for new duties that require training and grant no compensation, there will be minimal participation by the navigator community. So I just want to make note that this is something that we need to have more discussion about.
Thank you, members. Moving on, we're going to move to public testimony next. I know Senator Jensen has some other amendments, so if Sarah Durr and Dave Brooks could join Senator Jensen at the table, and then we'll move to Leah Greenside and Christian Hotzen. You can decide who would go first. Welcome to the committee. State your name for the record and proceed.
Good afternoon, Madam Chair and members. My name is David Brooks. I'm the Director of Pharmacy for Astrip Companies. You may know us more commonly as Sterling Pharmacies. We operate 15 community pharmacies in southern Minnesota and 2 in Iowa. First of all, thanks for prioritizing this important bill. Affordable diabetes treatment is a growing problem for our largely urban population. I think it's important that our patients have access to emergency insulin at our pharmacies, especially where they know their pharmacists and they trust them. We're eager to be part of the solution, and we thank Senator Jensen for recognizing the valuable role that pharmacists play in a patient care. So I've been asked to be here today to give a short overview of what happens when you fill a prescription at a pharmacy. When patients arrive at the pharmacy, pick up a prescription, whether it's a new or refill, we gather as much demographic and health information from the patient that we can, if we don't have it already. We also gather any prescription insurance information they may have. We process the prescription following the requirements of the Minnesota Board of Pharmacy. Part of that process involves submitting the information to the patient's insurance plan. Within a few seconds, we see the patient eligibility, the reimbursement for the prescription, and any patient copay that there may be. We provide the patient with a receipt that indicates what the patient's plan has paid, if anything, and what their copay is. Pharmacist meets with the patient, delivers the medication, counsels, answers any questions, provides any demonstration of use if necessary. If the patient happens to have a manufacturer's coupon, we process that much the same way as we would a third-party insurance, whether it's a commercial plan, Medicare Part D, Medicare. In most cases, it's actually input as a secondary plan. We process the prescription to the primary insurance plan. That information then is transmitted to the processor of the manufacturer coupon. They run it through their rules, and they send back to us a discounted copay for the patient and hopefully some reimbursement for the pharmacy. Both third-party insurance plans and the manufacturer coupon processors send their reimbursements to the pharmacy 15 to 30 days from that point. Unfortunately, sometimes take a little longer. But we would hope that the insulin program would follow a similar process in the pharmacy. We would appreciate quick, efficient way to get these patients the care that they need. We'd also like the transitions between the manufacturer and the pharmacy to be smooth as well, whether it's a reimbursement model or a replenishment model. So we've also provided Senator Jensen with a list of some process questions to help him fine-tune the best way to operationalize this program. We want to be a continued resource for pharmacy along with MPHA, and we're happy to answer questions at any time. Thank you, Madam Chair and members, for listening.
Thank you. Ms. Durr?
Madam Chair, members of the committee, thank you for having us here today. My name is Sarah Durr, and I am a pharmacist and the executive director at the Minnesota Pharmacists Association. MPHA does represent all pharmacists, student pharmacists, and pharmacy technicians across the state of Minnesota, and we also work with the Minnesota Alliance, Pharmacy Alliance, which is jointly with the other pharmacy organizations in the state. We really appreciate you and your colleagues taking the time to address this insulin affordability problem for patients. We applaud you for your efforts to address the immediate emergency need as well as provide relief for patients that may need a longer-term affordability issue. MPA and Minnesota Pharmacists and Pharmacies support Senator Jensen's insulin safety net emergency and longer-term insulin legislation. The bill utilizes existing patient medication access infrastructure and envisions the use of current manufacturer patient assistance programs for those who cannot afford their insulin. I actually spoke with one of our members before coming here today, and she noted that the Novo Nordisk and Lilly programs are working very well for her, so I appreciate the use of those programs. After discussing the bill with our pharmacy members, we believe that this bill will be workable and something that will work well for patients to utilize in the pharmacy as well as the pharmacy can implement from the standpoint that we see. A couple of points we wanted to point out on this bill. Pharmacists will continue to act as patient advocates and assist in getting the patient over to a navigator so that they have the information that they need in order to have long-term solutions to their insulin shortage. We also believe that the copayment at the $25 for the emergency and the $75 for long-term contemplated in this bill is sufficient to not only help the pharmacy with the dispensing cost, but also for any counseling that we may need to do. And this may include things such as walking the patient through how to use the insulin. It could also include looking at their other medications and making sure that there are no issues with those. And then also, we may have to have the patient a little bit more counseling on dietary issues or the timing of when they take their insulin. So that is a big time consumption for the pharmacist to sit down and talk to these patients about these medications. And we definitely do appreciate the A26 amendment, and that helps clarify really what that looks like for our patients and for the pharmacies. Minnesota pharmacists support affordable medications to our patients, and we look forward to working with the Senate, House members, and Governor Waltz to finalize the insulin patient assistance program for Minnesotans in need. I am happy to take any questions as well.
Thank you, and I'll ask you to depart from the table. Leah Greenside and Christian Hotzen, and then Nathan Lowy and Philip Plager on deck. Senator Jensen.
Madam Chair, I'd beg the committee's diligence or forgiveness. We've not talked about the 828, but I am going to ask Dr. Greenside to comment on that because she was the author of that.
And Senator Jensen, would you like to take the time to move the 828 now forward for discussion so Ms. Greenside can talk about why it matters to her?
Madam Chair, I would like to move 828.
Okay, so members, if you could look at the A28 amendment, it is before us, and Senator Jensen, you and Ms. Greenside can address the content of the 828.
Thank you, Madam Chair, and thank you, colleagues. When we're finished with a lot of the detailed work we're doing right now, I will try to provide a summary, and certainly this is a large part of it, so I'm just going to jump straight to this. But a big part of what's going to make this program work is integrity. And without meaning to impugn anybody's reputation or hurt anybody's feelings, I would say that integrity is related to trust. And there is a lack of trust in terms of how we're dealing with the cost of insulin in the state of Minnesota. When a product goes from 2 or 3 pennies a unit in 2000 to 40 cents a unit in 2020, there's a concern. The concern doesn't necessarily imply wrongdoing, but there's a concern. What this amendment does, jumping forward, is this provides a strong measure of integrity. This gets at the aspect of accountability to make certain that what the legislature is pledging to Minnesotans is taking place. This calls for a program review by the Office of the Legislative Audit, the OLA. It identifies what we want to look at. It goes on to call for program satisfaction surveys, and a lot of this work came from Dr. Greenside's input. I think this is critical, that the programs that we're allowing to be the main constructs of the operationalizing of this bill, we have to know that it's doing what we think it's doing. And I think that's what this does. Using an audit, using program satisfaction surveys will help us greatly. So I know you haven't had a chance to study the details of this amendment, but I think it's a good amendment. And I believe because there will be a fiscal component to it, I would ask that Madam Chair advise me in terms of how we proceed, but I would think that we could perhaps discuss the amendment, have Dr. Greenside comment on it, but perhaps then we would withdraw the amendment until the fiscal note is returned.
Thank you, Senator Jensen. There isn't a fiscal note prepared for this, but between now and finance, this appears to be relatively straightforward and could have a fiscal note ready before finance. But we don't generally move language out of the committee without a fiscal note attached to it. And so if we could discuss it, have this committee understand it, and then prepare it to be offered in finance. So Ms. Greenside.
Madam Chair.
Senator Jensen.
Have I moved this amendment then forward or not?
You did move it, and you can withdraw it, but I think we should let Ms. Greenside talk about
I haven't withdrawn it yet, Madam Chair.
You have not.
Thank you.
Thank you, Madam Chair and members of the committee. My name is Leah Greenside. I live in St. Paul with my husband, my 11-year-old son, and my 13-year-old daughter with type 1 diabetes. Normally, when I introduce myself, I just say I'm a small business owner, but I will elaborate. Professionally, I'm a program evaluator. I have a PhD from the University of Minnesota in program evaluation and have worked in the field for about 15 years with governmental and non-governmental organizations, doing the kind of work that's described here in this amendment. I've worked closely, for example, with Clearway, Minnesota on evaluation of their quit plan services programs, and that was part of the inspiration for wanting to bring to you today an idea for making sure that we hold those accountable for preserving the health of Minnesotans with this program by the kind of evaluation described here. This was particularly important to me after I met with some of the pharmaceutical companies this fall and asked them questions about their patient assistance programs, and I wasn't satisfied with the type of quality assurance that they described that they were doing or the type of data that they were able to provide to us. So this kind of rigorous and comprehensive, independent and external evaluation, I think will provide all of us with some comfort that these programs are going to work, and if they don't work, we will find out why, and we can tweak this so that we make sure that no one falls through the cracks. So I'm very pleased to have worked with Senator Jensen to work to develop this amendment, and I'd be happy to answer questions if you have any.
So members to the A28. Senator Kiffmeyer.
Thank you, Madam Chair. I think it's a great idea to do this, to have a program review, program audit, whatever we want to call it. The Office of the Legislative Auditor does do program audits and things, that's what they usually call them. And, but usually it is done through the legislature via a topic selection, which we just completed, actually. And I know you have a requested here, that means may or may not. I think this is a very important that it should be done. And so if that's the case, generally, as you know, Madam Chair, we've usually had the legislative auditor, there's a cost involved with that. So if you want to require, and I think this is a really worthwhile thing to do, and it's added to the other work, the Office of the Legislative Auditor, Mr. Nobles, should have input into that. And the challenge is when you have all of us as legislators who do these topic selections, there's only room for so many, and they have a very heavy plate on them. Matter of fact, they would like to do more with HHS, but they just cannot, and there have been some ideas on how to free them up to do that, but I don't think we could just straight out add to it without somehow finding a way to pay for it.
And Senator Jensen, did you want to address the concerns about the legislative auditor?
Madam Chair, I think, thank you, and thank you, Senator Kiffmeyer. I think Senator Kiffmeyer's comments are spot on, and I think since we will be withdrawing this amendment in waiting for a fiscal note in regards to what would this cost, I think during that time we could probably talk to the legislative audit body and see if we can't come up with language that more precisely identifies what we need, but I don't think we need to take any action on our input right now.
And Senator Jensen and Senator Kiffmeyer, this is language that's okay with the legislative auditor, and it is my intention to request that the fiscal note include the costs associated with the legislative auditor doing this audit so that we can be more prescriptive.
Thank you very much. I think that'd be good.
Senator Rosen.
Thank you, Madam Chair. Just a reminder, Insulin is before the Finance Committee next week.
Yes.
Wednesday.
Thank you. Anything further to the A28? Okay, Senator Jensen withdraws the A28 amendment, and we will revert to testimony. Ms. Greenside or Ms. Hotzen, who would like to go first?
Okay, I'll go. Good afternoon, Madam and members, Madam Chair and members of the committee. My name is Kristen Hotzen, and I'm here as the mom of a 12-year-old boy who has type 1 diabetes. I want to thank you all for your efforts to craft a good bill that will make sure that Minnesotans aren't kept from the insulin that they need because of cost. The current version of this bill relies heavily on manufacturer patient assistant programs. And to start, I want to say that my family has been helped by these programs, and I am grateful for them. At the same time, they have been confusing and unpredictable for our family, and I'd like to share a little bit about that right now. Excuse me. In April 2018, I applied for a patient assistance program offered by the manufacturer of the 2 insulins that my son was using. The card was vague. It said, save on your prescription, but there were no details about how much we could expect to save. It didn't say how long the program would last, and it stated that they could rescind, revoke, or amend the offer at any time. With the card, we immediately noticed a decrease in the price of my son's rapid-acting insulin. Our after-insurance price went from $350 to $150 for a box of this insulin. This was a great deal, but sadly, we only got that deal twice, and then it went back to its usual high price. In contrast, we didn't see any discount on his long-acting insulin after getting the card. We continued to pay over $300 for a box of 5 pens. But then something strange happened. In January last year, our refrigerator ran cold, and all of my son's insulin froze. It was ruined, and we called the insurance company and asked for an emergency refill, and they denied that. So I talked with my pharmacy, and she allowed me to buy a partial box at retail price, which was a new thing for us. And so we got just 2 pens to hold us until our insurance would cover more. The next month, I went back to pick up his refill. Like in January, they gave me 2 pens, but this time the cost was only $25. I was stunned. Per pen, that was 5 times cheaper than what I usually paid. After some experimenting, the pharmacist found that this discount only applied if we bought 2 pens. If we purchased the 5 pens that we had been prescribed, we would pay hundreds of dollars. Same things if we tried 3 pens or 4 pens. Had I not randomly purchased 2 pens instead of 5, we would have never known about or received this substantial discount. To twist Forrest Gump's quote a little bit, using the patient assistant program is like a box of chocolates. You never know what you're going to get. Patient assistant programs can be tremendously helpful, but if they are going to be the cornerstone of this bill, there need to be some patient protections. Manufacturers need to clearly state the discount and the eligibility requirements and how long the program is going to last. And there need to be teeth in this bill so that insulin manufacturers will follow through on what they promise. Diabetics need to know that these programs will be there when they need them, or this bill will be worse than having no bill at all. Thank you again for your work on our behalf.
Thank you. Ms. Greenside.
I'll let others have time.
Okay, thank you. Mr. Lowy and Mr. Plager. Welcome to the committee. State your name for the record and proceed.
Thank you, Madam Chair and committee members of the committee. My name is Nathan Lowy, and I'm here as a representative of T1 International and the Minnesota chapter of Insulin for All Advocates. Our executive team, consisting of diabetics and their caregivers, have been reviewing this bill with the inclusion of the A19 amendment since we became aware of its existence after finding it online earlier this week. We commend the senators for their continued work towards a solution on this bill. However, there are still several areas which need further amendments in order to assist Minnesotans first over manufacturers. We've come to realize that some members of the committee have a lack of empathy regarding personal stories, so we're going to skip straight to the areas of concern. In A19, lines 2.21 through 2.28, and later in line 3.25, eligibility includes the requirement of the patient not having access to a 30-day supply of insulin at $75 or less, and requires the patient to pay up to $75 for their emergency supply. We view $75 as far too high for someone who's in an emergency and may otherwise normally receive their insulin for a cost at $76 or anything higher. Instead, we would prefer to see the dollar amount lowered to an amount which an individual who has recently become unemployed and therefore in a financial hardship could afford. Moving on, lines 3.15 to 3.16, the pharmacist will dispense insulin equivalent to that of a 30-day supply. This, combined with lines 5.1 through 5.12, in which up to 17 days may pass during the application process for a long-term program with no further emergency supply available, is simply not enough if the patient is denied. Assuming the patient applies for the long-term program the same day they received an emergency supply, they may be left with just 13 days until they're out of insulin again. That is illogical. Instead, we would advise at a minimum to include language that, in the event of a long-term program denial, would provide the patient with an additional 60-day supply at a cost not to exceed that of the first 30-day supply, thus allowing the patient time to apply for and receive a decision on other programs. If you want me to pause at any time, Madam Chair, please let me know. Lines 7.17 to 7.19 regarding the penalty on a manufacturer for noncompliance. $100,000 is the equivalent of 130 one-month supplies of insulin. With approximations of over 16,000 Minnesotans eligible for an emergency fill with this bill or the House version of this bill, we feel this would be setting up patients for a continuation of the status quo. We're open to discussion on a penalty, but we're not in agreement with the proposed $100,000 figure. Lines 8.1 to 8.3 regarding the sunset. Insulin dependency is lifelong. Sunsetting a program that will provide emergency access to an individual stricken with this disease is not a voter-first move. Therefore, we would recommend changing the wording from sunset to something along the lines of review for amendments, thus eliminating a hard stop on a program that will save lives year after year. Moving away from the amendment and back to the original bill, leaving eligibility for long-term programs at up to 400% of the federal poverty guidelines is not enough. Most patient assistance programs cap their level of assistance at 400%. We realize there are many individuals who would be left uncovered and wouldn't have the income to allow for a change in budget of upwards of $20,000 per individual annually. We ask the authors to increase this level to 500%. Lastly, it has not gone unnoticed that there seems to be more confidence in the manufacturers to do the right thing than there is in our state employees' ability to manage a program. If manufacturers were going to do the right thing, we wouldn't be here testifying today. Furthermore, we would not be mourning the losses of 3 known Minnesotans who all paid the largest cost imaginable due to the lack of action by these companies. We thank you for the opportunity to testify in front of this committee today, and we look forward to being included in the conversation to prioritize Minnesotans over manufacturers. Thank you.
Thank you. Mr. Plager.
Madam Chair and members of the committee, thank you for this opportunity to be able to appear in front of you today. My name is Philip Plager, and I am a pediatric resident physician at the University of Minnesota. And I've been following this debate very closely because I take care of a lot of young patients with diabetes that I think could benefit tremendously from this great opportunity that you all are working on. I've been able to casually talk with colleagues of mine across specialties in the Department of Medicine, in the 4 different hospitals that I work in the emergency department, and there's a lot of excitement about what you all are doing. This is personally important to me as well because I was diagnosed with type 1 diabetes when I was 14. This hits home for me because I myself had a period of time in which insurance was a difficult thing to come by, and I had financial difficulties myself, and despite my family's best intentions, it was difficult to get the care that I need. And so I myself was in a position of rationing, as I see rationing affecting numerous patients that I take care of. And what this looked like, I'm sure that you've heard testimony in this regards is looking for free vials of insulin wherever you can find it, reusing needles, asking for handouts, and it's an incredibly humbling experience to go through. So, first of all, I just want to say thank you to you all for taking this on, and it's been a real privilege to hear the discussion that the committee is having. I think it has a great ability to touch a lot of Minnesotans. My objectives here were to highlight some things that I've already heard discussion about. So first and foremost, I want to thank Senator Jensen in bringing up the removal of the percentage of income requirement to be able to be eligible for an emergency supply of insulin. As was discussed, that might not be the best assessment of bearing of the financial need of the family in that moment, and should not prevent emergency insulin from tipping that family into crisis. And I just want to echo just a few things that I heard from Senator Wickland, and these were points that were important to me as well, is the idea of where we set the copay. I'm still trying to understand by reading the text if for the emergency insulin program, if the copay is $25 or $75 in the emergency program. But truly, if $75 is the amount that could be charged for the emergency program, I'm thinking about some of the families that I take care of and think about some of the other financial needs of the family and thinking that copay could be prohibitive for them. And so what I would encourage the committee to do is move closer to what I've seen in the House text, closer to the $25 or $30 copay. And the other point is the idea that when there is instability and turbulence in a household, oftentimes that can last for longer than a month. And sometimes we need shock absorbers for longer than a month and that buffer to last. And I would encourage the committee to consider extending the emergency benefit for longer than a month. I know that previous versions of the text had an ability to reauthorize emergency insulin past the 30-day period, and I think that could be very helpful for many families. So, in summary, I am encouraged and excited by the work that's being done here. I think it has the ability to touch very, very many people. And Madam Chair and Senator Jensen, thank you for all that you've done.
Thank you. If you could depart the table, please. Sharon Lamberton is next on our list. Welcome to the committee. State your name and proceed.
Thank you, Madam Chair. My name is Sharon Lambert, and I'm with the Pharmaceutical Research and Manufacturers of America, the trade association of more than 38 member companies in Washington, D.C. I want to first start by thanking you and also thanking Senator Jensen for the incredible work that you all have done to focus on access to insulin for patients in Minnesota. It's extremely important to us as well as an industry, as a trade association, that patients have access to medicines that they are not able to afford. We are very proud of the work and the innovation that our industry has been doing. We have about 170 new medicines in development for diabetes, and we look forward to more. Our industry does acknowledge the patient assistance programs that we have available could work better. We do have incredible programs that are offering patients assistance that they need of our 3-member companies, but this bill does a great job also of acknowledging these programs and creating more comprehensive education and awareness about these programs by publishing it on things like the Board of Pharmacy website, for example. There are a few concerns, to get right to it, that we do have some process questions I'd like to forward to Senator Jensen, that we have about 3 questions or so on the actual process. But I would sum the majority of our concerns would be around clarifying any constitutional concerns we have. I am not a constitutional lawyer, but we are concerned with the how the manufacturer would be compensated for the insulin product, which would be the taking clause or the Fifth Amendment concern. But we do want to work with you all. We're looking forward to continuing our work with you. Our goal is to make sure that patients have access to the needed medicines that we work very hard to bring to market. And I appreciate your time and the opportunity to testify.
Thank you. And I'm going to ask you to stay at the table because we do have a couple of amendments coming, and I think your comments, should you wish to make them, will be relevant. So members of the committee, discussion, otherwise I know there are a couple more amendments. Seeing none, let's move to.
Do you really want discussion now, or do you want to do the amendments?
Let's do the amendments,
Yeah, thank you.
and then we'll move to discussion. Senator Jensen.
Madam Chair, I would like to move the A29 amendment.
And members, the A29 is in your packet. Senator Jensen, could you please explain the A29?
Essentially, what this amendment does is, if you will, restrict the requirements for the patient assistance programs in regards to eligibility, sustainability, and accountability to any company that generates gross revenue from the sales of insulin in Minnesota to more than $2 million. There are 2 or 3 small companies that you probably have never heard of that do indeed manufacture insulin and have a very small element of sales in Minnesota, but they would not have assistance programs and things like this. So I believe that it's best if we just exempt them right out of the blocks and realize that Novo Nordisk, Eli Lilly, and Sanofi have over 95% of the market.
So, questions from members? Senator Wickland.
Thank you, Madam Chair. I guess my question would be, that's a gross revenue amount, but do we have any sense of how many patients does this impact? And then does it affect the amount that they're paying for their insulin?
Senator Jensen.
We can do a little bit of math together, Madam Chair.
Senator
Okay.
Jensen.
Well, approximately 500,000 Minnesotans have diabetes. Some diagnosed, some not, but they have it. And that's 10% of the population. And if you take 10% of that, you'd have 50,000. And we're probably looking at somewhere between 50 and 100,000 people that would use insulin. And if we think that of that insulin market, 1 to 2% of it goes towards these very, very small contributors, I guess you'd probably be talking about somewhere around 500 to 2,000 patients. But I doubt that it's that big.
Senator Wickland.
I guess, Madam Chair, Senator Jensen, I guess I'm not sure I can tell that the impact to the patients is different, buying their insulin supplies, to know whether excluding them is really, if that makes sense. I guess I would like to see more information about, I mean, if they're if the patient impact is still the same for these small manufacturers, I guess I'd like to understand better why they wouldn't be able to have an assistance program or participate. So I'm not
Madam
sure I
Chair.
would support this.
Senator Jensen.
Madam Chair, I submit this amendment so that we don't necessarily have to take those patients and cause them to do something different than they have been doing, because if you put the same requirements on a company that has less than $2 million in gross revenues, you're just going to drive them out of business, and I just as soon not do that. I don't think that would serve the patients well.
Senator Klein.
Chair and Senator Jensen. Senator Jensen, can you elaborate on the products produced by these low-volume manufacturers? Are they clinically interchangeable with the short-acting and long-acting insulin that we would receive from Eli Lilly and other manufacturers?
Senator Jensen.
Madam Chair, to my knowledge, Senator Dr. Klein, I believe that these are all analog insulins, rapid-acting and long-acting, but in terms of specific names and compositions and whether they're a pro-insulin molecule or otherwise, I could not.
Senator Klein.
So, Chair, to that point, and I think what I'm gathering from what you're saying is that in the event that a person had a product, that the diabetic was using a product that was not covered by the insulin safety net program because it was from one of these low-volume producers, they could be clinically safely switched to, a different product without clinical impact. So.
Senator Jensen.
Madam Chair, Senator Klein said it better than I could.
Thank you. If we could, and Senator Kiffmeyer, were you to Senator Klein's point? Okay. Do you want to remove your name from the list?
What was that, Madam Chair?
Did you want to remove your name from the list? If you were
Yes,
to Senator
yes.
Klein's point? Thank you.
Question asked, question answered, I'm good.
Thank you. Senator Nelson.
My question was also answered, so I don't need to ask. I just wanted to make sure there was an option available for all.
Madam Chair,
Senator Jensen.
maybe I should ask that Senator Klein answer most of these questions.
Senator Marty.
Madam Chair, my only concern is that people are not being left out, and if
Okay. Senator Marty, thank you. So to the A29, any comments from the representative from Pharma, Ms. Lamberton?
Madam Chair, no comment at this time.
Okay, thank you. And with that, members, Senator Jensen moves the A29. All those in favor say aye. Opposed? The amendment is adopted. Thank you, Senator Jensen. And members, I have the A27 amendment. Our primary objective is to get affordable insulin into the hands of patients at the point of sale. And it would be really nice to do it without rebates, coupons, patient assistance programs, et cetera. And so there are two parts to this amendment. The first is a recognition that there are emerging biosimilars in this market, and they're represented as being more affordable, and we believe most of the time a biosimilar is going to be brought to market below the cost of a branded product. And so generally, they would be meeting some of the low-cost requirement. However, I did hear in the process of drafting this amendment, there is one biosimilar that appears to be coming to market or perhaps intends to come to the market close to a branded price. And therefore, in paragraph C, we address the biosimilars. I did put a point of sale cost in place. I know there is considerable heartburn over putting a point of sale cost because of costs built into the supply chain. But I want to be clear with the manufacturers of these biosimilars that we want you to bring them to market at a lower price. I'm happy to continue to work on what language like this could be as we move towards the end. Again, this is about getting lower cost product into the hands of patients. In paragraph D, the current administration has issued 2 reimportation pathways. They're out for rulemaking, and they should be finalized sometime in March. One is importing from other countries, including Canada. That is emerging to be quite problematic. The second is issuing a new national drug code for a product that would be outside the traditional rebating and insurance product system. And so paragraph D deals with that, to encourage manufacturers of these products to reissue an NDC outside of the rebating system. Again, it has the point of sale cost. I know that is problematic because price setting is controversial and perhaps legally perilous across the country. But I do want us to continue talking about alternative ways, that it's not just a manufacturer's assistance program, but there are ways these industries can bring lower cost products to market while we continue to work on fixing the bigger problems in the market. And so with that, I'll offer the A27, and I look forward to feedback, comments, and Senator Jensen comments.
Thank you, Madam Chair. Colleagues, one of the chief benefits and values of having a robust conversation like we're having is just exactly this. This is forward thinking. This is looking at convoluted, labyrinthine transactions in an insulin market that puts diabetics' lives at risk. What I understand Senator Benson to be doing with this amendment is trying to strip the transaction clean, get rid of the rebates, get rid of all the hullabaloo, come out with a product that's high quality, that's a biosimilar, which in the world of biologics is, if you will, equivalent to a generic in the more small molecule marketplace. As it is, though, my fear would be that when we do the point of sale at 175, that if one of the large 3 manufacturers right now would go out and repackage some of the products they have, and in so doing, whenever you repackage it, you get another NDC. That's a specific NDC number. You could conceivably take some of your product, put it in different packaging, offer it for 175, and then be exempt from this program. And if we did that, we would have a tremendous number of people that are accustomed to being on everyday products like Novolog and Humalog and Levemir and Lantus, and conceivably any support for them would be gone. And we would have literally Grand Central Station as we try to have primary care physicians and endocrinologists accommodate and, if you will, cross-cover their patients with new formulations or at least products that have new NDC products. So to me, this amendment warrants more discussion even now, but as is, I could not support it as an author, as a friendly amendment. I would want and ask Senator Benson to allow the conversation to take place, and I would specifically look to Dr. Klein for his thoughts on this. But at the end of this conversation, I think that this would make the work we have in front of us more challenging. But I very much appreciate the forward thinking that comes from this, because what we're trying to do is we're trying to look at a crazy marketplace and say, somehow, we have got to lead the conversation. And to me, that's what Senator Benson is asking us to do, despite the fact that I will not support it as a friendly amendment.
Senator Klein.
Chair and Senator Jensen, I agree. Thank you for this ambitious and visionary effort to cut through the chaff, as you say, of the pharmaceutical pricing market and set expectations for what Minnesotans will need to balance our patients' life-saving needs for medications with the industry's need to balance their books. I agree that Senator Jensen, Senator Wickland have worked out a very delicate arrangement here with several partners. We've heard testimony from people who have concerns, but nobody who openly opposes the bill. I would be nervous about introducing an amendment like this that disrupts that harmony. I'm grateful for the ideas. I hope we can continue to discuss them, and I would hope that the amendment could be withdrawn at this time.
Comments from other committee members? Okay.
Closing comments from me?
Actually, I know that there are some concerns with this amendment from the industry. If Ms. Lamberton, you'd like to address some specific concerns.
Madam Chair, I appreciate the opportunity. I am just now seeing this language, so I haven't had a chance to talk to anybody back in my organization about this. I would like to review this. At first blush, I'm concerned just at the 175 looking like a price control, but again, I want to work with this committee. We need to look at this and just talk about it. So can you take it back?
Thank you, Senator Jensen.
Madam Chair, regardless of what happens in terms of what decision-making you go through, imagine if this language would govern EpiPens, where there's just one EpiPen, and we could come out and we could see something like this, strip away the rebates, make it clean, and have the manufacturer say, we will make EpiPens for $125 or $175. So I'm hoping that all the work that's gone into the insulin discussion over the last year does provide fruit in other areas as well, because it isn't as if anybody in the Minnesota legislature wants to ignore those folks who are dependent on other vital life-sustaining molecules as well.
Thank you. And Senator Jensen, in your opposition to this amendment, is it to the amendment in its entirety or to paragraph C or to paragraph D? Because paragraph C, biosimilars are coming to market, and your bill would compel them as a manufacturer to set up a patient assistance program.
Madam Chair, thank you for the question. I certainly object to paragraph D, because I think that would be, I think in the world of football, I think they call that an end run. But I think in letter C, right now, we have one biosimilar, and that's Basaglar. And that's a joint venture between Boehringer and,
BI, and I don't remember the other one.
it's Boehringer and one of the major three, and I'm blocking on which one it is. So again, it might serve as an avenue for them to say, well, we will do it with that, and then we wouldn't have to do it with the others. So I think we would run into problems there because Basaglar is Boehringer and I just don't remember if it's Novo Nordisk, Eli, or Sanofi.
So Senator Jensen, to be clear, you're opposed to both paragraphs?
I am.
Okay. Then I will withdraw the A27 amendment, members. Now to discussion on the bill as amended. Sorry, we'll start a list. Actually, Senator Marty, could I go to you last as the lead on the committee? Senator Abler.
Well, thank you, and I just want to do some commendations here. Senator Jensen, I want to commend you for you put a ton of work into this. I've been watching. We've spent many times talking back and forth about where this is coming, and it's coming in for a landing. Senator Wickland, thank you, and Representative Howard, the sincere work that's going on there. I know that I've talked to countless people about this, and I hope that they see clearly that the Senate is sincere in getting this going in a real way, and this is actually getting to be semi-workable. Just for people's advice, the $40 million version from across the street is a really big challenge. And just to remind folks on math, which seems to be coming up a lot today, Minnesota is about 2% of the country for population, randomly 1/50th. And so the impact nationally on a $40 million price tag from Minnesota would be $2 billion or more across the country. And if Ms. Lamberton is concerned about takings, I predict that the people she works for would be very concerned about a $2 billion impact, and they may have something to say about it. And I think you'll have arguments before every Supreme Court you've never even heard of before that will tie this up to assure that no one is helped. And the pressure on us is not May 18th. The pressure on us is to make sure that no one die in Minnesota for lack of insulin. And the pressure is on the next person who's truly at risk. And so I see this as just a great step forward. The impact on the state is actually minimal, and the manufacturers, who I have had very mixed feelings about, have shown some good faith in coming forward. They have actually evolved a lot in the years since this first came up, and I want to give them credit for that. Still clunky, still people are having a challenge. But it seems like we're weaving our way into a level of involvement that the manufacturers are not going to call it taking. And we have a severability clause, so part of it could go forward if it somehow falls apart. But this is a very, very good step, and I'm just going to leave it at that. And I am so excited for how the progress has been. Thank you to all.
Senator Nelson.
Thank you, Madam Chair. Senator Jensen, I do thank you for this bill in front of us. I know it's been a labor, but well worth it. And so I am pleased to see this. I am glad to see that we are leveraging a pre-existing program so that Minnesotans who cannot afford their insulin or need emergency insulin can get that without us developing another government-run health program, or in this case, drug program. We don't have a very good history of government-run medical programs, for example. So I'm pleased to see this. I think it's a huge step in the right direction. And I just have one comment to consider as things move forward. While I was uncomfortable with the biosimilar amendments with the price control, however, I would say we must be cognizant of the fact that biosimilars are really critically important, and I could not tell in the legislation, but we do want to make sure that anything we do does not intentionally either cause a rise in biosimilar costs, or more importantly, even lead to their demise or lack of development. So we want to make sure that we continue to allow for that, and I'm sure that the chair will find a way to do that without the cost control measure. But again, Senator Jensen, thank you. This is a good bill, and it's good for Minnesotans, and it's good for Minnesotans who have diabetes, who need a low-cost insulin or emergency insulin. So thank you.
And I'll look to this side of the table. I'll let Senator Marty make comments last. So Senator Wickland?
Thank you, Madam Chair. Yeah, I'll just be brief. I want to say thanks to Senator Jensen for continuing to work so hard on this. I think it is, a testament to how important we see being able to provide assistance and correct the issues that we're seeing and that the advocates are bringing forward. And I appreciate your taking the input from those who are advocating for people with type 1 diabetes, and that we're making progress. And I also want to say I appreciate that we were able to make some amendments today that, will kind of move the ball forward, that we don't have to go back and continue discussing. And then I look forward to working on the issues that were raised. And also appreciate that you're willing to incorporate the program evaluation language, because I think that's really important. So thanks, and I look forward to it moving on.
Senator Marty.
Thank you, Madam Chair. I will join what others are saying about appreciating the great progress that's been made. I think not having doctors dispensing is a big step forward, and I think this way seems to work, what I'm hearing from the pharmacists and so on. It's funded by the manufacturers, where I think the responsibility for the high prices is, the problem from the high prices has come from. I also like the chair's attempts to try and look at what would we have if we didn't have these rebates, and I mean, these manufacturer assistance programs and rebates are discounts. Are going to save people money, and each time, every year, with more of this, it gets more complex. And I think it was Ms. Hotzen who was saying how these programs are so bizarre trying to follow. You get them, and then they disappear, and then they're not here. And Senator Jensen, somehow you have the manufacturer's discount program. You're putting very strict guidelines around it, so if they do what they're supposed to do in this, I wouldn't say it looks like the programs they have now, but it'll accomplish what we wanted to have accomplished, and that is that people can get affordable insulin. So I applaud you on all of those things, because it's huge progress. I'll say I think there's still some big things to go. The program evaluation, I think we've talked about, and I'm glad to see that amendment and hope that moves forward. I do think the $75 copay is significant problem. It's easy for us to, well, $75 is a lot cheaper than something else. But again, we're having some of the people in this are just above Minnesota Care and so on category, and $75, when I see how many middle class and upper middle class people don't have $500 hanging around to deal with a medical emergency or something, $75 does hit a lot of people. Next thing I think I'd say we should keep looking at is I think you had an earlier version where you could get the emergency insulin for 2 months, 1 month, and then repeat it. And I think something like that, we ought to have a little safety thing, like Senator Nelson's extension from 5 days to 7 days for when you get it. We don't want people who are, well, I guess I can stretch this out this long. That's the whole thing we're trying to prevent. And I do think if it takes too long for somebody to sign up for the longer-term program, the repeating a second month may be a good way to deal with that. And then the only two other things is, one, the penalty if they don't comply. I think penalty is not a problem at all, assuming they comply. Let's make sure they're going to comply, and I think the penalty may need to be taken care of for that. And then finally, the sunset. You have a great thing going. If I thought 2 years from now, 3 years from now, we're not going to have an insulin affordability problem, I'd say, fine, let's sunset it. But I think there are those 4 or 5 issues that we've got to keep working on, but again, I'll applaud both you and Senator Wicklund for bringing it this far, and I think we'll get close.
Senator Jensen, closing comments.
Thank you, Madam Chair, and thank you, colleagues, for your comments. I'm just going to jump backwards on one thing. I did get a chance to talk to a fellow named Dr. Stephen Schondelmeyer about it, and I sent him the bill, and I asked him to look at it over. And I think many of us have met Dr. Schondelmeyer, and he has said exactly what Senator Marty just said and what Senator Wicklund has said. He believes that our co-pays in our bill presently are backwards. He says you have $75 for a 30-day emergency supply, and you have a $25 copay that's allowed when a pharmacist dispenses a 90-day supply in the ongoing program. He said if you reverse those, he said you would have a $25 copay at the time of that 30-day emergency, and then you would have a $75 for a 90-day. And I think that makes a lot of sense, and certainly we're going to have those kinds of discussions. So I would just say, last night I got a phone call at 9 o'clock. It was a patient of mine who says, I've got a friend, he needs some help. I said, I'll see him this morning. So I saw him at 7:45. He's lost 40 pounds, feels miserable, no insurance. Diagnosis, diabetes. He's most likely going to be on insulin. No insurance. I just want to remind you, if we don't have something change, we're going to have more people like Alex Smith, and we just can't afford to do that. I think, understandably, manufacturers are proud of the support programs they have put in place, as well they should be. And they have acknowledged that their programs have grown and improved through the years. And what we're saying is, we're here to help. We're going to help you make your programs better. They're going to provide the insulin we need for those people at risk. And we're going to help you so that nobody falls through the cracks. And we'll help you by making sure that there's accountability measures, that there are reviews and things like that. And in response to that, we want to respond to your needs too. As a manufacturer, we understand that you don't want to be taken advantage of, that you want to make sure that the product that you provide for low cost or at no charge, that you understand that it isn't being used in a way that's not intended. So this is a mutual walk forward. But at the end of the day, the Minnesota legislature has got to pass a bill. And that bill has got to have the level of accountability that we need from the manufacturers so that the activists, the House, the Senate, the governor, and most importantly, all of Minnesota says, yes, this is a job well done. This is a step along the way. Thank you.
With that, members, Senator Jensen renews his motion that Senate File 3019 as amended be recommended to pass and sent to the Committee on Finance. All those in favor say aye. Aye. Opposed? Thank you, Senator Jensen. Members, we are in recess. Sorry, the bill is passed. We are adjourned.